Hi, hello, namaste, welcome back to our channel. My dear student, for the last session I have discussed about what is the meaning of aneurysm and what are the types of aneurysm. My dear student, today I would like to discuss about what is the rest of the part belongs to the aneurysm. So the continuation is the clinical manifestation is also called as signs and symptoms. Once the patient gets the aneurysm, the patient is showing such a kind of signs and symptoms. The first one is deep pain. Yes, absolutely. When the aneurysm is gets, the pain is the ultimate thing. That is the deep pain he will get, and nausea and vomiting he may get the symptom, and constipation, problem with the urination, and the clammy and sweaty skin, and headache, rapid heart rate, and shock. The shock will get due to the hemorrhage due to the aneurysm. So this is the clinical manifestation where we can observe. So what are the diagnosis text? If you want to find out in-depth analysis of the aneurysm, you need to do such a kind of diagnostic test. The first one is abdominal X-ray, abdominal chest X-ray. It is a specialized X-ray which is going to help for the analysis of the abdominal aneurysm. You can find out where exact position by the chest X-ray. And next one is ultrasonography and the echocardiogram. So because of this, you can understand what is the size of aneurysm. So how much length of the affected area of the blood vessel, that you can find out through ultrasound as well as echocardiogram. And next one is computer tomography, is nothing but CT scan. So CT scan is observed the size and shape of the aneurysm, how the shape will be happen. So that will be observed by the computer tomography, nothing but CT scan. And one more important laboratory test is nothing but MRI scan, is nothing but magnetic resonance image. So this is observed pinpointing of the size and exact location. So this is the very important analysis technique where we can understand pinpointing area of the aneurysm. And next one is angiography. So as I told you, angiography is a catheter. So cardiac catheter we will insert to understand where exactly blockage of the blood vessel. So this is the different kinds of the diagnostic findings we need to do. Next we will move on for the what kind of the management we need to do. The first one is preventive measures. So some of the preventive measures we need to find out. The first one is preventing of the aneurysm from the growth. So if it is happen less, then your ultimate principle in the management is stop the growth of the aneurysm size. And next one is prevent the treating of rupture of. So if it is get little rupture, you kindly stop it by using some kind of suitable drug and medications, and allow the patient to continue doing their normal daily activities. Don't allow the patient to do more activities, just only normal daily activities. And next one is what kind of the medicines you need to supposed to give to the patient. The first one is painkiller, and second one is calcium channel blockers. Next one is vasopressors and anti-seizures. So these are the medicines we need to give for those who are suffering with cerebral aneurysm in order to compressing of the complications for the order. And next one is what are the things, what is the main surgery you need to do. The surgery you need to do, as you can show, endovascular repair. So nothing but you can insert the tube, you can put the one kind of the shunt where the blockage is happen, where the aneurysm is happen. So see the location and send the one catheter, then you can put one shunt like a graft. So that will be surgery is called as endovascular stent graft, that name of the surgery. This you need to do for the endovascular repairment to maintaining a smoothing of the blood flow in the blood vessel. So that's about the surgical management. So being the nurse, what is the your management in the endovascular surgery or for the patient, those who are suffering with aneurysm? So you need to assess the pain of the patient, whether it is chest or abdomen, and you need to monitor the fluid level in order to prevention of the shock for the patient, and you need to continuous monitoring of the vital sign, blood pressure and pulse and respiration. And next one is assess the bleeding rate as well as assess and monitoring of the heart rate. So that you need to do, and you need to do monitoring of the laboratory values in order to prevention of further complications for the patient. And next one is monitoring of the urine output and input, that will be called as IO chart. You just monitor the close monitoring of the IO chart to prevention of the further complications, that is a shock. So that's about prevention techniques. And next one is how you can prevent the infection. So just prevent and monitoring of the WBA, I mean white blood cells. So you just keeping monitoring of the eosinophils and basophils. So WBNC, I mean cells are there, no? So that cells you need to be monitor. If it is getting more, that leads to the infection is more in the blood. That's what you need to get the monitor. And you need to monitor the signs of the infection. If it is a more infection, you try to give the administering of the antibiotics as per prescribed by doctor. So that's about today's session, my dear student. Today I have explained about what is the signs and symptoms of the aneurysm, and what is the medical treatment and what is the surgical treatment, what are the preventive measures we need to find in order to suppressing of the aneurysm within the blood vessel. So that's about today's session. I will come back with another new session. Until then, stay tuned. Please like and share and subscribe. Thank you so much, my dear students.